Hi, I'm Dr. Ashoojit Kaur Anand. I'm the Clinical Director at PCMH Restore Health, Bangalore, and the Founder Director of Aviksha, a home-based primary care at PCMH Restore Health. My expertise is in HIV, palliative care, and the elderly care. Well, palliative care means providing a holistic, person-centered care, where the palliative care means covering of the symptoms of the person. And in a dementia patient, it is a challenge because a person is unable to express their symptoms or tell us as to what the person is going through, or even tell us if there is a pain or what is the level of pain. So it becomes a challenge for the physician to know as to what to manage here. But palliative care physician has to be very empathetic to understand what the symptoms are and how do we manage these symptoms. And also, palliative care expert is not just about managing the person, but the caregiver and the family as well. It's not just providing the symptom relief for the patient, but also the psychological support which is offered to the family as well is very important here.